Hi, good morning. So I'm gonna perform incentive spirometry. So first is make sure we check the patient's chart, make sure we obtain any important information, and then also include checking if the physician did really order an incentive spirometry. Once inside, introduce ourselves to the patient, and then at the same time explain to them what the purpose of this therapy is, such as, good morning, my name is Anthony. I'm from the respiratory care department. So the doctor ordered you this therapy, so this would help you aid even more, especially to help you expand your lungs, prevent your lungs from being at collapse or atelectasis, reduce any secretions, and also help you cough even more. So potential outcomes for this one is it would help you improve, it will improve or even reduce the atelectasis. It would improve your chest x-ray, also improve breath sounds, and also improve vital signs. So after that, wash your hands also, and then wear appropriate PPE such as gloves. So after we're doing those, we always make sure we do our set of vital signs, assess the patient, make sure we always perform an auscultation, which is really important for this therapy. And then if the patient is elderly, or if depending of what type of patient, we can let the patient ask if they can sit upright. If not, we can assist them or adjust the patient's bed. If some patients who just came from surgery who are still experiencing pain, we can put something in place in front of them, such as a pillow, where they can hold it like this, so that it would help aid or prevent any pain, especially if performing this device. So after doing those, every time we perform the therapy, inspect the device for any cracks, and then make sure we also demonstrate in front of the patient so that they would understand really well. And then when holding it, should hold it upright. And then based on myself, as I will be doing myself as a patient, we should set the appropriate volume or pressure based on its gender, height, and its age. So mine is, it's almost about 2000. And then after that is we let the patient exhale the air out until their lungs are empty, away from the device. After exhaling all their air out, insert the mouthpiece to their mouth with their lips sealed and tongue not obstructing the mouthpiece. And then after that, let the patient take a slow deep inspiration until this white piston would rise. After that is you let the patient breath hold for about 3 to 5 seconds, and once the white piston would drop, remove the mouthpiece and exhale normally. So we can try it once. Exhale. So if we want to do multiple attempts, make sure we let the patient rest for a few seconds. And then if we wanted to, especially if this is initial trial, we can start it at least about 5 breaths per hour until such time we can reach the 10 breaths per hour if they are able to tolerate it. Every after attempt, allow the patient to cough, by the way, sorry, and then take note of its color, consistency, and its amount. And then once done, remove the device. They should not soak the device to the water, except for the mouthpiece, where they can clean it with sterile water and cover it with a clean tissue. And then we should also educate the patient if they can do it every hour. And then if those patients who complain any complications such as lightheadedness, fatigue, or discomfort, we can tolerate it, and then make sure we chart it to the chart once done. And then once everything is done, we position the patient back from its original position, make sure they are comfortable, and then every time we're done doing the therapy, we do vital signs, assess it, make sure we auscultate it if there are any improvement, and then before going out, remove PPE, wash our hands, and chart everything what we charted, observed to the patient. And if the physician is present, make sure we communicate it with them, and even the nurse in charge.